Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about a super difficult topic. I've had a lot of DMs about it, and I've definitely taken care of patients who struggle with it too. It's bottle refusal. So bottle refusal can present at any time. This is different from a nursing strike. If you have questions about a nursing strike, make sure you check out our video done in the past about how to handle a nursing strike. Bottle refusal can be really difficult because it's something you're trying to avoid in the beginning, and then when it happens, it's usually kind of a difficult hurdle for a parent to overcome. Generally, we usually say it's the mother because the mother is trying to do other things, potentially go back to work, or even just go run errands or have some time to herself, and the baby is refusing the bottle. When a baby refuses their bottle, that means that mom might be obligated to nurse, and or if they're going to daycare and doing bottle refusals, they might start doing something that we call reverse cycling, which means they're not drinking enough and consuming enough calories during the day, so then they're staying up at night when their parent is nearby to be able to nurse, and that way you're not getting enough sleep and you have to go back to work potentially. There's a lot of different theories and techniques out there. Some people say that mom should be the only one to give the bottle. Some people say that mom should not be anywhere in the house or even on the same floor as the person who is giving the bottle, and mom should never give the bottle because if mom gives the bottle, then the baby's automatically thinking, well, this is the person who nurses me, why are they giving me a bottle? So it really depends, and my advice is typically tailored to the patient that is in front of me for the lactation consultation. So here are a couple of things that I think can help. Generally, we say to wait 3 to 4 weeks before introducing a pacifier to the baby who's exclusively nursing, especially to help establish latching, establish a good bond, establish a good flow of breastfeeding. That being said, you can definitely start introducing a bottle in small quantities at different times. And I do feel like that is different from a pacifier, and I'll explain why. Because pacifiers are non-nutritive sucking, so you're able to potentially then allow them to calm themselves down with a pacifier, but they're not able to really get in milk. And also, pacifiers are not really built, that nipple in a pacifier is not built the same way as the nipples for a bottle. And when you're looking for a bottle, you're going to want something that has a long tapered tip, right? Because you want it to really hit the back, that soft palate. Generally, having a broad base, it can be helpful for some bottles. It's not as helpful for other bottles. It really depends on, again, the length of the nipple. I like to go for slow flow or at least stage 1 nipples. I don't think you necessarily need to go for preemie flow bottles. But again, that's just my recommendation. It would also depend on the baby that's in front of me. I don't think every single baby that comes in front of me or every single baby deserves to have a preemie flow bottle. If you're finding that you're wondering how baby's going to do with the bottle, I have a bottle here in front of me. This is just one that I believe I actually got free from the hospital. Usually what I say is allow the baby to at least gum, and it could be empty or it could have formula or breast milk in it, but usually I say allow it to be a little empty so they can gum on it first and allow this nipple to become something they understand and it's not really being shoved in their mouth or something that's unfamiliar. Now, once the baby is comfortable with the nipple being in their mouth, you might want to try dipping it into express milk or into formula. If your baby is formula feeding perhaps, or you're supplementing with formula, you might try dipping it in and then putting it back in their mouth so they kind of start to associate that this is something that they can feed out of too. Remember, we're just making friends with the nipple here. We're just getting them used to it. Now, we are going to talk a little bit about pace bottle feeding towards the end of this video, but there are a couple of things that I do recommend when you are giving the bottle to the baby. You could try bouncing on a yoga ball. I found that this is very helpful because I think it's the gentle rocking motion. I do find it a little bit difficult to walk while feeding baby the bottle, especially if you're trying to do pace bottle feeding. But one thing you can do is very calmly sort of pace or swing or sway, and that yoga ball allows you to do that. It kind of allows you that swaying motion while still at least having your feet on the ground or at least being a little bit firmly rooted. Something else you could do sometimes is going outside. Now, A little bit of distraction may be helpful in this case. So I'm not saying go outside and go for a brisk walk while trying to feed baby, but going outside allows you to kind of have a little bit of extra stimulation so that the baby can kind of unfocus a little bit, just so that they can at least start to take the bottle. Another option is offering the bottle just as the baby is waking up. Now this can be super helpful, again, because the baby is not hangry and they're not super focused yet, and you can get them to potentially latch and take that bottle. This is also something that can help with a nursing strike too, so you may have heard this tip before. So let's jump the gun a little bit and talk about pace bottle feeding, because this is super, super important. So pace bottle feeding. Generally, what I have parents do is I want you to really actually sit the baby up on your lap. So we're gonna try this really quickly. I'm sitting on the floor right now because I still have like boxes that I'm in the middle of unpacking. If you don't know, I just moved back home to my home state of North Carolina. So not in my parents' home, but to my home state of North Carolina. There's a lot of boxes around. Filming this on the floor, but we're gonna prop baby up on my knee. So baby's not laying supine while I'm giving them the bottle, but they are actually sitting up just a little bit. So you can have them at 45 degrees or so. And then this is, let's say, a newborn baby, or at least less than 3 months old, and I'm supporting their neck. Their body weight is pretty much resting either on my lap, or maybe there's a pillow on my lap and raising them up a little bit. But essentially, you know, you're trying not to ruin your posture, but bring baby up and have baby sit up a little bit too. And what we're gonna do with this bottle, again, this is just something that I got free from the hospital, but what you're gonna imagine is, oftentimes I recommend sort of tickling the nose or tickling that top of their lip, and it kind of gets them a little interested. And then when they start to take the bottle, you are again going to want to aim for a bottle that has a long tapered tip, that one that can kind of hit their soft palate and allows for a nice deep latch. So you're going to have the baby take the bottle, and you're actually going to keep it just like this. I am not tipping it this way. The flow becomes a lot faster and very quick, and almost a little too gratifying for your baby, if you will. So we got to make our baby work for this a little bit, just like they would if they were breastfeeding. So you're going to allow the baby to take the bottle, and you're going to try to keep it actually at pretty much, I want to say, perpendicular, if you will. And you're going to want to see them audibly not only just sucking, but swallowing. So one thing I see is that when they kind of get lazy, or they start closing their eyes, or they're not sucking, you're going to want to withdraw the bottle just a little bit. And then you're going to want to actually see, are they interested to keep taking the whole bottle, right? So if you withdraw the bottle and they immediately kind of pull the bottle back in and begin to suck, that's exactly what you want, because that's how the breastfeeding mimicry of sucking, swallowing, let down again, sucking, swallowing, and then they're able to really trigger other letdowns with breastfeeding. It's exactly kind of what you're going to want to mimic. So you're pacing their bottle feeding. That means that this bottle feeding can take up to 15 to 20 minutes. And that's okay. That's exactly what you want. Now, we're going to get to a certain point. This is a 4-ounce bottle. Let's say it's filled with 2 ounces. You're going to get to a certain point where you're going to have to tip the bottle a little bit more so. And that's okay. But in the beginning, when the flow could potentially be the most in the bottle because it's the most filled up, that's when you're going to want to absolutely work with pace bottle feeding. Now that's just an intro course into pace bottle feeding, a really quick, teaching, and I definitely think there's more that you can learn about this. It's going to take some practice. I've taught it to my husband so that he feeds the baby the same way. I've taught it to our kids' nannies so that they feed the baby in the same way. I think that's super important. So it shouldn't just be, non-uniform across who's feeding them. It needs to be the same person. That also helps with the transition into bottle feeding, so that if you are away from the baby, the person who is giving them the bottle is the same as the person who's home giving them the bottle or feeding them. And that can really help with bottle refusal as well. So if this video was helpful, please make sure to give it 2 thumbs up. If you have any questions, make sure you leave them in the comments, and I will see you next time.